Hi everyone, I'm Dr. Akhila, Consultant, Fertility Specialist, Sudha Hospitals, Hyderabad, Banjara Hills. Today we're going to talk about a condition called as Polycystic Ovarian Syndrome, PCOS. Now let's quickly understand what is PCOS and what are the symptoms, the primary symptom being infertility, how to deal with it. So PCOS can exist in about 10 to 20% of women who are in reproductive age group. What is PCOS by definition, according to the Rotterdam criteria, is that two out of these three symptoms have to be present. That is, one is oligo or anovulation, that is, there is irregular periods, hyperandrogenism, clinical or biochemical hyperandrogenism, that is, testosterone levels are high in the body, which can be measured through blood tests or if it can be identified clinically. The last is the ultrasound. When you have a PCO morphology seen on the ultrasound, that is, the ovary volume is more than 10 cc or more than about 20 to 25 follicles are seen in each ovary. These are the three features, two out of these three, if they're there, then it is termed as PCOS. Now, what happens in PCOS is, that is the pathophysiology, there is increase in androgens, there is increase in insulin resistance is there, that is hyperandrogenism, hyperinsulinemia. These two conditions are the major features which cause increase in hormone levels, that is LH, luteinizing hormone. All these put together cause anovulation because they decrease something called as sex hormone binding globulin. All these features put together, they cause problems in ovulation, which means in simple terms, there are multiple eggs in the woman, but a single egg which normally grows and ovulates, that process does not happen. And what are the clinical features? Usually, the woman exhibits is that irregular cycles, acne, hirsutism, obesity, and fertility issues. So let's quickly deal with the problems of fertility in women. Now, why should women have fertility issues in PCOS? The reason being, like I already said, no ovulation and ovulation, that is the biggest problem. Also, the egg quality is very poor in these women, so even if they do conceive, they can have problems of miscarriages because the endometrial lining, also the vascularity is less because of the hormonal changes that are there, and they're more prone to miscarriages. Also, during the treatments, they can be more prone to something called as ovarian hyperstimulation syndrome. This happens because there is more stroma in the ovary, and therefore there is more vascularity there, which can be a cause of ovarian hyperstimulation syndrome. These are the conditions, these are the primary problems that are there which lead to infertility. Now, what is very important to understand is that these women are not permanently infertile. They just need a little help in the form of lifestyle changes and maybe some medicines, and they can conceive easily. Let's understand what are the different methodologies that are there, the treatment options that are there for these women. The first option being weight loss. So this is of paramount importance. Weight loss, even 5% of weight loss helps in a natural conception. The 5% of body weight loss that we are looking at actually contributes to about 20% of visceral fat loss. So that helps in hormonal changes. And these women normally have an android type of obesity with a waist hip ratio of 0.7 to 0.8. So, how to lose weight is obviously through diet, eating a healthy diet, and exercise about 150 minutes per week of moderate exercise. And these two are something that help not only in fertility but also improves the general health. Now, when women are obese or morbid obese, That is, if your BMI is more than 35 or 40, the normal BMI is being 18 to 25. So these women can undergo the option of bariatric surgeries. And once this surgery is done, for about 1 to 2 years, they cannot become pregnant. So this is the mainstay treatment, the first line treatment, that is to lose weight. The second option is in terms of medications. Certain drugs can help bring about ovulation. So, what are the drugs that help us? Is one is clomiphene citrate. This is a time-tested drug. For the longest time, we've been using clomiphene. It is safe, and how it acts is it acts on the hypothalamus. It increases the FSH and LH, and in turn the estrogen, and that's how ovulation is brought about. Better than clomiphene is the drug of choice nowadays is letrozole, which is an aromatase inhibitor. And what this does is it helps in monofollicular development, that is, a single follicle grows, and therefore chances of multiple pregnancies, OHS, is much less with letrozole compared to clomiphene. So these are the two drugs that we commonly use to bring about ovulation. And along with these two drugs, we can add on gonadotropins depending upon the response of the patient, whether she's able to grow the egg or we need additional support. Based on that, we can add in gonadotropins, that is FSH injections when required. Apart from these drugs, metformin and steroids are something we routinely use. Now, how do these two drugs help? Metformin is an insulin sensitizer, so it decreases the insulin levels and helps in bringing about ovulation and better response of the drugs that we are using. Also, metformin is used in women who are more prone to OHSS. So, when the women are high risk for OHSS, better to start metformin. Metformin is also helpful to regularize periods in women who are not looking at fertility. So this can be used for a period of 1 or 2 years at a dosage of 1,500 milligram per day. Metformin helps in these kind of women as well who are not looking at fertility. Steroids, dexamethasone 0.5 milligram taken at night, helps in modulation of these drugs, brings about ovulation and a better response. It decreases the androgen levels. This is how these two drugs act. Now, this is about ovulation induction. We can use these drugs for a period of at the most 1 year, which means 10 to 12 cycles of ovulation induction, either with natural intercourse or IUI, but not beyond a period of more than 12 cycles. If a woman has not conceived, it is better to step up and go for the next option, that is IVF, in vitro fertilization. IVF in PCOS is a standard protocol that most of us follow, which is an antagonist cycle with an agonist trigger, and a freeze all policy is usually applied because the hormone levels are so high. If a transfer is done in the same cycle, it can lead to OHSS. The trigger also is an agonist trigger. So with this kind of a protocol, the chances of OHSS are much, much, much less. And the newer technology is IVM, in vitro maturation. That is, the oocytes are collected at an immature stage. 2 to 3 days of gonadotropins are given, and the oocytes are taken in the GB, that is germinal vesicle, or metaphase 1 oocyte stage. Now, these oocytes are then collected, retrieved, and they're cultured in a biphasic culture media, and the mature cells are then injected with the sperm outside. So this is called as in vitro maturation. The advantage of in vitro maturation over IVF is that it is less expensive and used in women who are more prone for OHSS. These are the treatment options that are available in PCO. Thank you. So some questions, please. What should I do to get rid of PCOS? PCOS is not something that you can get rid of. It is a genetic, it has a genetic predisposition. It is something that is there inside of your body. That is, the ovaries have multiple eggs. So what you can do to work around PCOS is something that I have explained, not something that you can get rid of. If you're looking at fertility, the options have been explained. If you're not looking at fertility, metformin is one drug that helps women who are not looking at fertility. It can help regularize your periods by balancing your hormones. Is there any chance of getting diabetes if I have PCOS? Yes. So we routinely check sugar levels in women with PCO. We do a fasting and 2 hours after, something called as OGTT. And these women are at a higher risk of deranged blood sugar levels because there is already a status of hyperinsulinemia. The intrauterine, intra-ovarian milieu is such that there is anyway hyperinsulinemia. The insulin levels are higher and there is insulin resistance also. So you are prone to diabetes. Regular testing is advised. PCOS a disease per se? PCOS is not a disease. Women just need a little help to get pregnant, and it is not a disease that you should be afraid of. It's just something that you require a little awareness about. Does PCOS result in cysts and cancers? Unlikely. Is there any cure for PCOS? Like I have said, there is no cure as such. So the problems related to PCO are irregular cycles, hirsutism, acne, obesity, and fertility issues. So it's a lifestyle modification that we are looking at. Once your diet and exercise are in regular place, most of these problems can be controlled. Any other questions, please? Okay, so there is one question, ma'am. Laparoscopy for PCOD drilling is completely safe or not? What is the success rate? So, laparoscopic ovarian drilling, the process is that there we put in a few holes in the ovaries on both sides. So, typically, we follow a rule of four. That is, 4 punctures, 4 mm deep, 40 watts, 4 seconds. This is the rule of four that we usually follow. And what happens is that the LH levels come down, the androgen levels come down, and it may bring about regular ovulation. But on the downside, the side effect is that it can decrease your AFC count. And some women may even land up in premature ovarian failure. So it is better to uh, treat PCOS in the different modalities that I have spoken about, then go for laparoscopic ovarian drilling. So typically, this was advised for those women who can't come back for regular follow-ups. If they are anyway going ahead for hysteroscopy or laparoscopy, and combined they would do laparoscopic ovarian drilling. So this was what was the concept before, but my suggestion would be to avoid ovarian laparoscopic drilling because it affects the AFC count and it can lead to premature ovarian failure. Any other questions, please? Here's wishing everyone a very happy Women's Day. Thank you so much.